So my name's Emma Taylor. I'm the Parent Carer Liaison Officer for ARFID Awareness UK, and I'm also mum to an ARFID sufferer. Oliver's nearly 5 and has been diagnosed with ARFID since 2022. Oliver unfortunately doesn't eat or drink at all and is entirely dependent on a PEG tube for all his nutrition and fluids. Some advice I would give you when you're going through this situation: it is really tough as a parent. And who do we reach out to for help? Well, other parents and carers can be a great support for you. There are Facebook pages. If you go to the charity's website, we can signpost you to links. And really what we've found, and what our parents and carers say to us, and what I found personally, is that reaching out to other parents in the same situation can really be supportive. So all food is good food. And that is so important when we're talking around our ARFID children, in front of them, and to other people. You know, we need to lose the preconceived ideas that, you know, it's unhealthy or they can't possibly eat that. We need to maintain growth. That should be our focus, and keep calories in. So all food is good food when your child has ARFID. Take the pressure off. Eating at the table is really not important. If your child is comfortable with a screen, a beanbag on the floor, playing with their toys, it's much more likely that eating will happen. If a child's made to feel pressure in any way, it can be really counterproductive, and sometimes sitting at the table isn't the right approach. Don't feel guilty, don't feel bad. If they have the iPad on the floor, if they lay on the floor in a beanbag, if they're playing with toys, whatever is most comfortable, because as we keep saying, we just need to prioritise growth and nutrition. And if that's an easier way to get more food in, then let's do that. It's not your fault. Don't feel guilty. I know I struggled really hard with, what have I done wrong? Why can't I get my child to eat? And it's not his fault either. It's not your child's fault. They can't eat, not won't eat. And I say this to lots of people. You know, it's a line that I say a lot now when it comes to talking about Oliver, or, you know, anybody with ARFID. They can't eat, not won't eat. There's no choice in the matter. This isn't a choice they're making. And so many people with ARFID who can express what it feels like for them tell us, tell the charity, and tell, you know, other sufferers that they want to eat. They want to eat so much, but they just can't. So another thing to talk about is the possibility of tube feeding, enteral feeding. My son is entirely dependent on his feeding tube for all fluid and nutrition. He started off with an NG tube, which goes in through his nose and down into his tummy. Nobody thought he would cope with that, me included. But we tried, and I'm so glad we did. Oliver is autistic and has learning disability, but still has coped for a good 4 months with that tube, without pulling it out and without fighting it. It was like a relief to him. The pressure was suddenly off and he was getting nutrition without having to eat. He then had a surgical feeding tube, a PEG, and that goes into his stomach directly. And he's had that for around 2 years now. Oliver has grown, Oliver is happier, and I just want other parents to know that it's not so scary after all. You know, we all hear about feeding tubes and we all think that is an absolute last resort and that is the thing to avoid. In some cases, it can be a really good thing, especially if you're looking at therapies further down the line like CBT or food chaining. Often that is more successful when the pressure is off, and a feeding tube does exactly that. It takes the pressure off. So one thing parents they really struggle with is dealing with other professionals and schools. You know, head to the ARFID Awareness UK resource section on the website and you'll find a booklet for schools. This can be really helpful when dealing with your child's school if you're struggling, for them to make reasonable adjustments around their eating. Also, there is a leaflet for medical professionals. When you first go to the GP, go armed with that. You know, a lot of the medical professionals we come across don't have a wide understanding of ARFID, but you can help. You can take the leaflets, you can take the information, use the resources section on the ARFID Awareness UK website.